Welcome to another video in Foundations of Maternal and Newborn Health. In today's video, we're going to talk about teratogens. And specifically, we're going to talk about drugs that are teratogenic or teratogens. So teratogens are just anything that cause birth defects. And so this can be anything. We're specifically going to talk about drugs today, but there are other things that can also cause birth defects, and we'll be talking about those in another video likely. So there are a lot of drugs that can cause birth defects. Most drugs do cross into the placenta to some extent, but only some are really harmful to the baby. So some of the more minor ones, but still worth noting, are NSAIDs. So this includes things like ibuprofen, which is of course Advil, and this is pretty commonly prescribed. So it's worth noting that NSAIDs should be avoided during pregnancy. The other big one is ASA, and this is aspirin. So this is another common painkiller that should also be avoided during pregnancy. And the reason for this is that both of these drugs cause premature closure of the ductus arteriosus. So if you don't remember, we covered this in the fetal circulation section, fetal circulation videos. So this causes premature closure of the ductus arteriosus. So you can go over that video again if you don't remember what the ductus arteriosus is, but you want to keep that open until the baby's born, and this gets closed prematurely if you take too many NSAIDs or aspirin during pregnancy. So the other big class of drugs that are also associated with birth defects are teratogenic, are ACE inhibitors. So these are used for hypertension or high blood pressure. So for hypertension, and these cause kidney defects. So you don't want to give these to mothers. They cause kidney defects in the fetus. The other big one are anticonvulsants. So this is used to treat, convulsants is seizures, so these are used to treat for seizures. And it's important to note that these are specific medications, so not all anticonvulsants cause birth defects, and all ACE inhibitors, but not all medication for hypertension cause birth defects. But it's important to note that some of them do. And so an important disease here is eclampsia, and we'll talk about this in another video, but this is a common pregnancy issue, and it causes both hypertension and can cause seizures. And so the reason that that's important is you don't want to give a pregnant mother with really high blood pressure ACE inhibitors to treat her hypertension. You need to use a different medication, and you have to be careful about what medications you use for seizures as well, because some anticonvulsants can cause birth defects. So another big class of medication that can cause birth defects are antibiotics. So antibiotics are really broad. So this is used to treat for bacterial infections. And not all antibiotics cause birth defects. In fact, very few do, but it's important to know that some do. And so again, if a pregnant mother has an infection of some kind, you want to be careful which antibiotics you give, because some are known to cause birth defects. The last one I'll mention here is just warfarin. So this is a blood thinner. It's not used very much anymore because it's been replaced by kind of newer drugs, but warfarin can also cause some birth defects and problems. So the last topic that I wanted to touch on are recreational drugs. So of course, these are drugs that people take for fun, obviously not prescription. So of course, the big one here is alcohol. And we may do a video just on alcohol during pregnancy, but this causes fetal alcohol syndrome. So you don't want to be drinking alcohol during pregnancy, of course. The other big one is cocaine. It's been suggested to cause birth defects, although its exact effects are still not totally known. And then there are some drugs, recreational drugs, that are not considered teratogens, so they don't consider them to cause birth defects, but they do cause problems during pregnancy. So things like smoking is a big one, of course. And so again, it doesn't cause birth defects, but it has been shown to cause low birth weight, higher risk of premature birth. It's also been associated with higher rates of stillbirth. And it's also associated with an increased risk for placental abnormalities. So you want to definitely avoid smoking during pregnancy if you can. Of course, many people struggle with getting off of smoking, but what is also important to note is that research shows that even reducing the amount of smoking during pregnancy improves outcomes. So even if you can't stop smoking completely, even reducing the amount you smoke is thought to be good for the baby. The last one to note is cannabis. So again, marijuana. The results on this are less clear. Of course, it's only recently legalized, but the SOGC, or the Society of Obstetricians and Gynecologists of Canada, they suggest not to use cannabis during pregnancy, and they believe there's likely similar effects as to smoking. So you want to avoid recreational drugs during pregnancy if you can, but of course many people struggle with that. So you got to do the best that you can. So the last thing that I wanted to touch on was dosing. Although all of these drugs are known to cause birth defects, the amount of drug exposure, or the dose, is important to consider. So if the mother is exposed to very little of the drug, the baby will actually likely be okay. And this critical amount that causes birth defects, depends on the drug that's being used here. So in some instances, you have to weigh the pros and cons of giving these medications to the mother to prevent a more serious illness if there's no alternative drugs. And a good example of this is ASA, or aspirin, which is currently used to treat preeclampsia, or as a preventative treatment in women with a history of preeclampsia. And again, we'll talk about preeclampsia and eclampsia in another video. But in this case, a low dose of aspirin, around 60 to 100 milligrams daily, has been shown to be safe for the baby while still providing some protection to the mother from preeclampsia. So there are a couple important takeaways from this video. Firstly, if possible, you should avoid using these drugs if there's a better alternative that's safe for the baby and mother and accomplishes the same job. And a good example of this is Advil versus Tylenol. So Advil, of course, is ibuprofen, and Tylenol is acetaminophen. And these do the same thing, of course. They're both painkillers. But ibuprofen is, again, a risk to the baby, whereas Tylenol has been shown to be relatively safe during pregnancy. And so it's almost always better to use Tylenol rather than Advil. So lastly, if there isn't an alternative medication, sometimes one of these medications is the only medication you can give, you have to weigh the risk versus the reward to the baby and the mother, and you need to be very careful about the dose that you prescribe. So again, coming back to that aspirin example, if you are going to use aspirin during pregnancy, you just have to be very careful with how much you give